Hello, my name is Catherine Schroeder, Vice President of Community-Based Programming with Aspire Health Partners. Today we're going to talk about coping with grief during COVID-19. Losing a loved one is universally challenging, but may be especially traumatic during COVID-19. Natural responses to loss, such as emotional numbness, intense sadness, anger, or guilt, may be compounded during a crisis like the pandemic. Social distancing and quarantine may prevent families across Central Florida from visiting their loved ones when sick or hosting public gatherings to mourn the life lost with those they care for. Regardless of how you are experiencing your loss, there are several self-care tips you may use to help you process grief amid COVID-19. First, it's important to recognize that mourning is a highly individualized experience, and there is no right or wrong way to grieve. This year especially, individuals across Central Florida may feel guilty about how they are responding to the loss of a loved one. Some may feel angry that they were unable to spend more time with their loved ones before their passing due to social distancing and quarantine, while others may feel emotionally numb. We put so much pressure on ourselves to mourn the right way. Regardless of how you are mourning your loss, it's important to remember that everyone experiences grief differently and that your response can and should evolve and change with time. Second, don't be afraid to reach out and accept help. You may be apprehensive to reach out to family and friends for support during the pandemic out of fear of being a burden in these circumstances. If you've ever been the person to support someone coping with grief, you know what a gift it is to be able to help someone you love during challenging times. If someone reaches out to ask how they can help, tell them how they can help you. For example, you may want to say, "I'm feeling good right now, but after the funeral, could you help look after my dogs?" Or, "I'm feeling overwhelmed. Would you mind helping watch the kids for an hour this weekend?" If you're unable to voice your needs, appoint someone you trust, such as a family member or a close friend, to speak on your behalf in order to help provide the extra support. Third, find creative ways to honor that person's life. Exploring creative ways to honor your loved one's memory during a time where we may not be able to physically convene may help you grieve. Consider virtual alternatives, such as hosting a memorial service, a candlelight ceremony, or a dinner with relatives on Zoom. You may also partake in activities that make you feel connected to your loved one, such as reading their favorite book, cooking their homemade recipe, or organizing a scrapbook of your happiest memories. Lastly, recognize when you may need to seek out professional help. If you are finding that your ability to function in day-to-day life is significantly impaired following the loss of a loved one, please consider seeking help from a mental health professional. For more information about how to cope with anxiety, depression, and grief during the pandemic, visit our website at aspirehealthpartners.com. If you would like to speak to a behavioral health professional, you may call our hotline at 407-875-3700, extension 2. A member of our team will be available to help you identify your needs, make an appropriate referral, and schedule an appointment.